I'm Stacey Galandi with Ask the Doctor, a LifeScript Cedars-Sinai Women's Health Report. Okay, let's talk bunions. Do you know what those big bumps are on your feet and how they get there? Well, guess what? There's an 80% chance that you'll experience foot pain in your lifetime. But don't blame it all on those sexy stilettos. It could be from extra weight, your designer handbag, or even your hormones. LifeScript's Mari Cartel has more on how to heal your heels.
Would you jam your feet into these tiny shoes? These were all the rage of the upper class during China's Song dynasty. But we women are still abusing our feet for the sake of fashion. And that's where most of our foot problems begin, according to Dr. Glenn Pfeffer, director of the Feet and Ankle Center at Cedars-Sinai Medical Center in Los Angeles.
The problem is high heels are unhealthy. You know, on a cigarette box, we have a warning that says if you smoke too much, it can cause certain problems. There's a law now in, I think, all states that you have to wear a helmet when you're riding a motorcycle. There's nothing on the side of a shoebox that says wearing heels can be dangerous to your health.
That's actually because squeezing those feet into mini high-heeled towers can actually shift your toes.
When you go from a 1-inch heel to a 3-inch heel, the force on the front of the foot goes up 7 times, not just 3 times. So a woman is literally walking on her toes with 7 times the force into a shoe that is deforming the toes.
Carla Luscious kept close watch on her feet because her mother suffered from bunions. So when she started seeing evidence of her own feet changing, she took steps to minimize the damage.
I'd wear a little bit of a heel, 1.5 inches or maybe a 2-inch, or if I had to wear something sexy or smart, it would be literally, I get out of the car, I walk into the restaurant, so I monitored what I wore on my foot.
By her 40s, Luscious realized bunion surgery was her best option and went forward with the procedure.
It was more preventative as well. I mean, even though it was a serious thing, I was just thinking if I waited 20 years, it might not be operable.
Luscious smartly stays off heels now because, as the doctor explains, bunions can return.
If a person wants to wear 4-inch heels that are very pointy, and they end up requiring bunion surgery, and they go back into 4-inch heels that are very pointy, they have a much higher chance of getting the problem back.
Looks are important, but now when Carla Luscious sees her feet, it's not beauty she's looking for.
I just feel healthy, and the scar is very minimal, which I guess I'm fortunate for, but really it wasn't about that. I couldn't be happier. I really couldn't.
From Cedars-Sinai Medical Center in Los Angeles, I'm Mari Cartel.
Thank you, Mari. Now Dr. Glenn Pfeffer joins us here in the studio. Welcome, Dr. Pfeffer.
Stacey.
Thanks for joining us.
You're welcome.
Now, this is something I definitely have suffered from, but talk to me about the high heel hangover and how to treat it.
The high heel hangover, it's just as real as your headache hangover. You spend a lot of time on your foot at night, partying, dancing, walking at a cocktail party. You're in a fashionable shoe that doesn't have much cushioning. It's often a little too tight, and it makes your foot hurt. The longer you wear it, the more your foot's going to hurt. The next morning you'll wake up perhaps not just with a little bit of headache, but a headache in your foot. It's unavoidable.
So what do you do to fix that hangover?
Treat it the same way you would treat your headache hangover. I think ice massage on the foot for 20 minutes, then stop, give yourself a break, and another 20 minutes, and some aspirin.
So it's really all about women just abusing their feet, right?
80% of American women wear shoes that are 2 sizes too small. And I think 80% of women will say they hurt in their shoes at some point.
Now, what types of activities actually contribute to a woman's foot problems?
It's a good question. In 1 mile of walking, anyone puts about 100,000 pounds of stress on their foot, just on walking. Walking on hard concrete makes it worse. Walking in a thin-soled shoe exacerbates it even further. Now add a heel and a high heel with a cramped toe box. It's a recipe for pain.
What is the most common foot problem for women?
Bunions.
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 So is there a specific treatment right now? Are there advancements in some of the surgeries?
The first treatment for bunion is to stretch the shoes out, try to lower the heel a bit, wear a shoe that's comfortable and doesn't deform the foot. If that doesn't work, surgery is a very good option. You have to cut the bone, you have to realign the foot. There's no way to minimize that. But the techniques that we use now hold the bones so strongly after surgery that the body actually doesn't recognize as much that there's a break that's occurred.
What role do hormones play in a woman's foot pain?
As hormones change in pregnancy or as we get older, it can affect the shape of the foot. It affects the ligament laxity, which may indirectly lead to foot pain, but there's no direct correlation between hormone or hormone level or menstrual cycle and foot pain.
You work in Beverly Hills.
Mm-hmm.
Do you do a lot of cosmetic foot surgery?
No.
Why not?
What cosmetic surgery means is that you're doing it for feet that are slightly misshapen that have no pain, and that's highly inappropriate. Unfortunately, there are people that try to advertise cosmetic foot surgery. You see it written about more frequently. Don't have your foot operated on, ever, unless it's painful.
So I am sure you have seen your share of problems on Dancing with the Stars, but what is the most common problem you've seen, and what's the most unusual problem you've seen with the dancers?
The professional dancers tend not to get many problems. They're used to what they're doing. Occasionally there'll be an injury. But it's the stars who come on that are not used to the rigorous schedule and the huge stress on their foot that run into problems. And the most common problem is what you'd anticipate, stress fractures.
What would you say are the top 3 questions that a woman needs to ask her doctor if she is suffering from any kind of foot pain or disorder?
The number one question a woman should ask a surgeon about surgery is, how can I avoid it? What steps can I take to avoid an operation? The next question then would be, how long will it realistically take to recover? I constantly see patients who are told that they're going to get back into shoes in 2 weeks. It's simply not the case. And the third question is what are the potential downsides of surgery? Surgery is wonderful. I do it all of the time. I have many, countless happy patients. But there's still potential problems with operations. You have to be an informed patient.
What are the most important tips for somebody buying a pair of shoes?
Yeah. It should be comfortable when you try it on. Don't wait for it to stretch out. Buy a shoe that's about 1/2 inch longer than your longest toe. You don't want that toe to buckle up and need hammer toe surgery. Buy shoes at the end of the day, because that's when your feet are most swollen.
Dr. Pfeffer, thank you so much for joining us today.
Thanks for having me.
Now, for more information about foot health issues, you can visit our website at lifescript.com and Cedars-Sinai at cedars-sinai.edu. This has been Ask the Doctor, a LifeScript Cedars-Sinai Women's Health Report. I'm Stacey Galandi.